Good morning, everyone. Good morning, everyone. Welcome back to my channel. I'm Shivani, and today we'll be discussing about developmental assessment and major milestones. The aim of this presentation is to give a brief note on development and know about sector-wise development of major milestone, brief on important development assessment tools, then developmental delay and red flags. So first of all, we'll be discussing about principles of development. So first principle says development is a continuous process. It is a continuous process. That means ये लगातार चलता ही रहेगा from birth till grave, right? Then the sequence will be same of that of growth, that is cephalocaudal, then proximal to distal, then generalized reaction to goal directed reaction, then primitive reflexes to disappear. ठीक है? So cephalocaudal means cephalo means head and caudal means towards tail, right? Proximal means from center to distal. Distal means to pass है. Proximal means to pass it, distal means to दूर है. That means from midline towards the periphery, right? Then generalized, that means normal reaction जो कि एक goal directed reaction के साथ मैच करेगा, ठीक है? और primitive reflexes धीरे धीरे disappear हो जाएगी, right? Then the rate will vary according to the growth and development. And it is also related to CNS maturation. CNS maturation के साथ ये related है. Next we'll be studying about major sectors of development, that is gross motor, fine motor, cognitive या फिर social, cognitive and social, then language, and also we'll be reading about vision and hearing. Gross motor milestone. Supine to pull to sit. Whenever we are pulling a baby to sit, their head will be lagging. As you can see in this image, the head of the baby is lagging. That means the child is not having neck control, right? So whenever we are trying to pull the child, the neck will be falling backward, right? The head will be falling backward in whichever direction we are pulling, right? I think this is clear to everyone. It is mainly seen when the child is at 6 weeks, 1.5 month, यानी कि 12 weeks मतलब अराउंड 3 months, ठीक है? सो 1 month is equal to 4 weeks. तो 3 महीने का जब बच्चा होगा, baby is held gently by the arms and shoulder and lifted from the center. So in this image you can see the baby has achieved हेड नेक कंट्रोल, ठीक है? तो बच्चे ने इस वाले में नेक कंट्रोल अचीव कर लिया. हेड लैग is not there. The children who is having head lag beyond 3 months are having some sort of neurological disorders. So if you are seeing these kind of symptoms in your child, then you should immediately go to visit to nearby pediatrician, a good pediatrician, and then further they can look into it whether it is too late or it is the child might achieve in 1 or 2 weeks. But most of the cases में they'll be achieving it by 3 months. At 20 weeks. 20 weeks means 5 months. Right? Baby is held gently by arm and lifted from the surface. So the newborn body is, then this is known as ventral suspension. When you are holding the newborn in your arm, on your palm, so the body is held above the surface in one hand so that it remain suspended in the air. The baby doesn't have control over their hands and their legs, so it will be suspended, मतलब वो एक लटके हुए की तरह होगा. That's why it is known as ventral suspension. If you look into it, this is at 8 weeks. Baby's body is held above the surface in one hand, so it remains suspended in the air. Then at 12 weeks, that means at 3 months, the baby's body is held above the surface in one hand so that it remains suspended in the ears. So you can see the difference between 8 weeks and 12 weeks. In this image, the baby doesn't have head control, right? And so you can see the difference in this thing. Head lag is still there, but in this thing head lag is the head lag is almost gone. So the baby's body will be held into this kind of suspension. Then when you put the baby in prone position at 4 weeks, the baby will not be able to have control. So in this thing also, baby is lying without any head control. So in this thing, baby is looking towards the surface. 12 weeks, baby is on a soft surface with the face towards the surface. So 8 weeks पे baby can be sitting and they'll be sitting with the help of support. 4-month child, they will be sitting back much straighter so the back of this baby, you can see it is much straighter. सीधी हो रही है अब ये back, right? So 6 months में baby will be sitting with support of the hands. So you can see over here the child is using its hand to sit. इसको tripod position भी बोलते हैं. So it will be achieved by 6 months. So the baby will be sitting without support at 8 months. So baby will be turning towards the object to pick the object at 11 months. So you can see in this image the child, the baby is moving backward to take his or her toys, and this is known as pivoting position. So I think I have mentioned here what is this position known as. What is this position known as? It is known as tripod position. Okay, everyone is clear with this thing? Let's go back to the previous slide now. So at 6 months baby can bear weight. So most of the weight the baby can bear at 6 months, and they can stand with the support of the examiner. That means the mother or caregiver need to give support to the baby so that he or she can stand. By 15 months baby can stand comfortably without any support. So 15 month here means 1 year 3 months. The baby will be crawling around 8 to 9 months, and the baby will be cruising. That means the baby will try to pick up the things and look into the things by around 11 months. Creeping means the baby will be crawling on his knees and try to move on his knees by 11 months. Crawling is a type of quadruped. Quadruped here means the baby will be using both hands and both the legs while walking, and yeah. So crawling is a type of quadruped. That means the baby will be using both the legs and both the hands, and the abdomen will be touching the ground. In creeping, the abdomen won't be touching the ground. So let's go back to the previous images. Now this is crawling. The baby is touching the abdomen. Here is the abdomen of the baby is touching the surface, right? And if we go back to this 11-month wala creeping, so in this you can see abdomen is not touching the, yeah, in this thing you can see the abdomen is not touching the surface. Standing in at 9 months baby will stand holding on to a furniture. 18 month baby can run. 2 years they can climb the stair with 2 feet at a step. That means both the legs they'll be putting like a step, like we are walking, no, in that way. And they can also jump. At 4 years they can hop. Hop means jumping from both the legs, they will be jumping from one stair. एक जैसे सीढ़ियों पे चढ़ के हम बचपन में कूदते थे ना, दोनों पैर इकट्ठे रख के, that kind of thing. By 5 years they can skip one stair and they can climb the staircase. Coming to fine motor, first of all 1 month will be always closing their hand. By 4 months they'll be holding both the hands together. जो दोनों मुठ्ठियाँ वो बंद करके लेटे रहते हैं, 1 महीने का बच्चा वो 4 महीने में क्या करेगा, दोनों मुठ्ठियों को पास लेके आएगा, and they'll try to overshoot or they'll try to hold both the hands together. By 5 to 6 months the baby can transfer the object. Coming to grasps, so we'll be learning here about the grasp. First one is palmar grasp, that means holding the object into the palm. That will be achieved by 5 months. Ulnar grasp means they'll be using the middle finger and index finger along with the thumb to hold the object by 8 months. Immature pincer grasp, it will be achieved by 10 months. And mature pincer grasp, pincer here means you can just remember it by pinching or taking a pinch of something, right? So immature they'll be achieving by 10 minutes. They'll try to hold the object for some time, but they don't have that much strength, so the object will fall down. And coming to the mature pincer grab, they will keep on holding the object with the index finger and thumb finger along with the index finger and middle finger along with thumb. So which milestone is shown? Pivoting, radial grasp and object transfer. So the baby is pivoting means it is, I don't know why this video is not playing, there is some issue. Okay, so the pivoting means बच्चा पीछे की तरफ मुड़ रहा है सामान लेने के लिए, and also it is having radial grasp and they can transfer the object from one hand to another. Do comment which milestone is this. The next, dressing, wide variation you can see. So they'll be removing the socks and cap by 1 year. So the 1 year child can remove their socks and cap. They can dress himself fully by age of 3. So my daughter right now, she has turned 3, so she can just remove her socks, shoes, cap shirt whenever she comes from school, so she can change her clothes. That's what I'm trying to say. Tying his shoelaces by 4 to 5 years. Then feeding, by 6 to 7 months they'll be finger fooding. That means they'll be taking something with the help of fingers and then licking it and having it. By 6 months they can chew. They can hold the cup by approximately by 1 year, that is by 12 months. But whenever they are holding the cup, there will be a lot of spillage at 12 months. And without spillage, that means when they might have turned around 15 months, that is 1 year 3 months, they can hold the cup without spillage. They can use the spoon by 18 months. Guess. So in this thing, they have mentioned the age and how much block they can make. A 15-month old child can make a tower of 2 blocks. 18-month can make the tower of 3 blocks, and by 2 years they can make a train. By 2.5 years they can make a train with chimney. By 3 years they can make a bridge. By 4 years they can make a gate, and by 6 years they can make a staircase. That means steps they can make. 3 year can make a tower of 9 blocks. So sometimes in MCQs they can ask regarding this thing. A 3-year-old can make a tower of how many blocks? 2 blocks, 6 blocks, or 9 blocks. Then there is also Gessel figure skills, which shows how the baby can write. A 3-year-old can, let's start from 15 months. So the 15-month child can scribble. That means they'll be scribbling something, something. And 2 years can imitate verticals and circular strokes. So they can make circles and vertical strokes they can make. By 3 years, they can make a proper circle. By 4 years, they can make a cross. By 4.5 years, they can make a square. By 5 years, triangle. Then complex images they can make. And by the time they'll reach 11 years, they can make a 2D image. At birth, fixation will be at a bright object, and they can see up to 10 centimeter of distance and at an angle of 45 degree. By 1 month, their range of vision will be fixed by 90 degree. By 3 months, they'll be fixating to 180 degree and grasping with the eyes. By 6 weeks or 4 months, there will be binocular vision will be there. And by 3 to 5 months, they will be hand regards, and by 1 year, they'll be following the moving object. So do comment in which age group they can go for this horizontal tracking. Then hearing, at birth they can startle, cry, blink in response to sound. By 3 months they will be turning head towards the sound, and by 5 to 6 months they'll be turning head sideways and down. By 6 to 7 months turns head sideways and up. By 8 to 9 months they can follow the object diagonally and direct. Social smile can be achieved by 6 weeks. They can recognize their mother by 3 months. By 6 months, they'll be having stranger anxiety. Then and also at 6 months, they can mirror play. That means they'll be looking at someone and they'll be laughing, something like that. Then by 9 months, they'll be waving bye-bye. By 18 months, they will be doing domestic mimicry. That means if you are praying, they'll also pray. If you are teaching, they'll also teach. If you're dancing, they'll also dance. By 24 months, that is by 2 years, they'll be doing parlor play. Parlor play means even if someone is there along with the child will play with the same toys but alone. They'll be not sharing their toys with the second person. Social smile, basically how you can identify when the baby is looking at you, they'll smile. दैट इज सोशल स्माइल. जब बच्चा आप देखते हो किसी भी न्यूबॉर्न को या बच्चे को एट द एज ऑफ 3 वीक्स, एट द एज ऑफ 6 वीक्स, तो वो बच्चा आपको देखता है और वो भी स्माइल करता है. दैट इज सोशल स्माइल. So this is mirror play. They'll be looking at the mirror and they'll be laughing and dancing like that. So a picture card, how they'll play. By 18 months, they'll be pointing to 1. By 2 years, they'll be pointing to 5 and 3 names. By 2.5, points to 7 and names 5 things. By 3 years, 8 names. By 3.5 years, they'll be knowing approximately 10 names. Handedness means it will be established around 2 years and firmly by 3 to 4 years. That means you can identify whether the baby will be right-handed or left-handed, which is the dominating hand of the baby. The sphincter control will be achieved by 15 to 18 months. So they'll be informing, okay, I'm getting susu like that, or I'm wet right now, please change my clothes. And dry by day by 18 months, dry at 9 by 2 years by 50%, and 3 years by 75%, and 5 years by 90%. That means कुछ बच्चे 2 साल की उम्र में ही रात को बता देते हैं, यस आई नीड टू गो टू वॉशरूम। कुछ बच्चे, अप्रॉक्सीमेटली 75% ऑफ द बेबीज दिल बी अचीविंग ड्राई नाइट बाय 3 years, and 90% of the babies will be achieving by 5 years. Next is language and speech. By 3 months, baby will be cooing. So they'll be saying vowels A, E, I, O, U. By 4 months, they'll be babbling. By 6 months, monosyllable ma, ba. By 9 months, they'll be saying mama, baba. Two words they'll be saying, right? By 1 year, they'll be saying 1 to 2 words with meaning. By 18 months, they'll be saying 10 words. By 2 years, 100 words. By 5 years, they'll be saying approximately 5,000 words. And also, girls have more talkative, so they have much more word limits. So Jagran will be achieved by 15 months. Isolated motor delay. Mm, Isolated motor delay can be seen in Down syndrome. Floppy infant hypertonia can be seen in cerebral palsy. Neuromuscular problems can be seen. Visual impairment can be seen. And language delay can be seen in autistic child. Deafness can be seen in autotoxic drugs. Coming to red flag. So in red flag, if there is no visual fixation by 2 months of the child, then it is a red flag. No vocalization by 6 months, no sitting without support by 9 to 10 months, then not standing alone by 16 months, not walking alone 18 months, no single word by 18 months, lack of imaginative play by 3 years, loss of comprehension, single word or phrase at any age. Then you need, if all these signs are there in any of the child, then you should immediately go to pediatrician. When will a child will do peekaboo? Please do comment. And this is the image of peekaboo. So as previously seen in Gessel's tower play, the child will be making train with chimney by 2.5 years and stairs by 3 years. Hands midline roll over by 5 to 6 months. It will be achieved. And visual fixation can be achieved at what age? Please do comment in the comment section. Okay, stand-alone casting in Jagran will be achieved by 1 year. Mature pincer by 1 year. And that's it. Thank you so much for watching my video. Thank you so much for watching my video. We'll be coming back with more such videos. Also, do comment what kind of other videos you want. And as I am from nursing background, I'll be also dealing with the nursing care plan related to newborn, infant, what all are the needs they are having. So please like, share and subscribe my channel. Thank you very much.